Hello.
right.
Oh, there we go. Perfect.
Well, good afternoon, and thank you for the opportunity to present our innovation with such a tremendous group of innovators. My name is Jason Flieger. I'm the Vice President of Operations of Orthopedics and Acute Care Surgery at Corewell Health in West Michigan, and I'm joined with...
Good evening, Geneva. My name is Erica Stevens. I am a family physician. I also serve as the Vice President of our primary care team at Corewell Health West in the wonderful state of Michigan in the United States of America.
Awesome. Well, we want you to take a moment and imagine that you are a primary care provider who's just finished up a very busy clinic day, and you're walking out the door on time and headed home to your family, where you'll be able to have dinner. And after dinner, you might even be able to get to a hobby or do something that helps you relieve the pressure from a busy day.
So, Jason, are you saying that you came up with an idea that would maybe eliminate pajama time? I mean, when I think of pajama time, I think of that late night inbox, just marathon at my laptop, cold coffee at my side, and that mental exhaustion, that full day of patient care, and then knowing all of those messages still need to get touched so that you can take the best care of your patients.
That's exactly right. I was able to go home, enjoy time with my family, and not have 4 hours of in-basket burden to manage. And that was the dream of Inboxology that we wanted to make a reality for our providers at Corewell Health, so that they didn't have to have the in-basket burden. And we knew that if we didn't do something to address in-basket burden for our providers, that we risked burnout, patient dissatisfaction, and certainly lost efficiency.
So you want to know kind of a little bit more interesting facts. So for primary care, we can get 30,000 up to 40,000 messages in a year. And what are all those? They are patient advice requests. They are follow-up phone calls. They are labs. They are prescription refills. Oh, I mean, when you just think about that amount of stuff, and it all pours in, it pours into that inbox.
For our primary care providers, it was like drinking from a fire hose, very intense, knowing that at the end of a busy clinic day, they were going to have multiple hours of working through in-basket messages from their patients, working during hours when they should have been with their families, and spending time doing things that they wanted to enjoy.
So Jason, you really came up with something like almost like a filtration system. Is that correct?
That's correct. The Inboxology program is set up like a smart filtration system. The first level of the filtration is with the ambulatory RNs, who first triage the messages, taking care of anything that's within their scope to manage. So things like patient education, simple patient advice requests, some referrals, and certainly completing refills per protocol.
Oh, so then after the RN has moved through some of those messages, and maybe they've addressed it to the scope of their level of licensure, is there some more magic that occurs?
Absolutely. At that next level, whatever the nurse isn't able to manage, the inboxologist is that next level. So they are a licensed practitioner, a physician assistant, or a nurse practitioner, and they're able to handle more of those complex condition questions, additional refills. We do e-visits as well, and certainly complete referrals on behalf of the primary care provider.
So I love this because it's like having this mini team of superheroes. And truly, I call them superheroes because they are diligently and at a high level of clinical expertise helping me get through inbox messages from my patients, allowing me to be able to focus on exactly what I love to do, being in that room with that patient, having that face-to-face time and not have that mental and heavy load on my shoulders, which I know is that inbox, which is something sometimes I dread popping into after I'm seeing my patients.
In less than a year, we rolled this program out to 48 primary care practices with 26 inboxologists, as well as now supporting 350 provider FTEs and about 425,000 patients.
So think of that. 48 primary care clinics, 350 FTEs of provider care. Since January, this team has touched over 450,000 messages. Think of that. That's 450,000 messages that the provider team did not have to spend time on. And those patients got clear, concise, and actually at times even faster service back on their messages because it was done in real time or absolutely done within 24 hours.
Inboxology was a program that redesigned how we did in-basket management.
100%. And for our providers, I will say what we've heard is, you've given me my life back. We now have providers who wear pajamas so they can go to sleep in them, not that they will chart in them.